This is the CBC Morning Report for Friday, May 12th. Good morning. I'm Tisha Hines. In our top story, the Pan American Health Organization has sounded the alarm on chikungunya. The number of cases of chikungunya in 2023 in the Americas has reached 160,000 compared to 122,000 in a similar period in 2022. This explosive increase in the southern hemisphere countries is worrying since it's the transmission season for the mosquitoes, while transmission season in the northern hemisphere and especially Caribbean will start in August. Another reason behind sounding the alarm is El Nino, the Western Pacific disturbance related to higher temperatures in the summer. To discuss what all this means is Dr. Singh, Advisor, Health, Surveillance and Disease Prevention and Control at PAHO. Good morning to you, Dr. Singh.
Good morning.
Thank you so much for sharing with us this morning. Now, let's first look at what chikungunya is and how it affects a person, say, compared to dengue fever, which we're more familiar with.
So in case of chikungunya, mostly the acute phase when you have the fever is usually mild, but what is complicating is the residual effects. So people, as the word goes, chikungunya, it means a bone-breaking fever. So you would get, those who have had chikungunya would very well know how it feels like. It's bone-crushing pain that you can sustainably have for about weeks to even months. Usually, sometimes it may last up to 6 months, 6 years. And this year's, we have seen some deaths in mostly infants coming out from South American region. So that's also a little bit worrying, although the number of deaths is still relatively low compared to others.
What stats, if any, do we have for Barbados, and what precautions can we take to make sure that we don't see the level of fallout that we have in other places?
So for Barbados, luckily, we haven't seen any case of Zika reported this year. Sorry, chikungunya this year or last year. We haven't seen any cases of Zika also this year or last year. There have been some cases of dengue, about 81 cases of dengue this year. Compared to almost 330 last year and 440 in the year before that. So comparatively speaking, I say the number of cases of these three diseases are relatively low. It's the same mosquito which transmits all of these three diseases. So basically you monitor all those three to assess the trends. And what can we do in the Barbados region? Well, we know there are no vaccines available currently for any one of these three diseases. Mostly what we can do is mosquito prevention, mosquito control. At homes, people are advised to wear long clothes, make sure that the receptacles that they have for water are clean. There's no standing water. They make sure that the mosquitoes are not breeding within their own households. Those are the minimal things that the Ministry of Health of Barbados has also been recommending over a longer period of time.
Now, we know that these diseases are spread by different mosquitoes. So is it possible that a person could contract chikungunya and, say, dengue simultaneously?
Absolutely. It's very possible to have all three of them together at one place. Of course, it's rare and also happens when you have both of these epidemics or outbreaks of both diseases happening at the same time. But the possibility does exist of having both at the same time, both or three.
All right. Are there any recommended medicines at all that one could say, for example, take beforehand, to minimize symptoms or make it less severe, if they're seeing early signs?
Unfortunately, that is... Yeah, unfortunately, there are no prevention medicines. There's no prophylaxis, if you may ask that way. So the only prevention methods are actually mosquito control to prevent yourself being bitten by mosquitoes anywhere. And as you might know, the mosquito that is responsible for Zika, chikungunya, and dengue is the same mosquito. It's Aedes, which actually can bite during the day as well as night. So the precautions have not only been taken during the night while you're sleeping, but during the day also. And the precautions, of course, when you're working in your offices or schools, that's where most likely the transmission will happen. Most likely the biting might happen. So those are the places that have to be protected also, outside of your houses.
What about people that are feeling the long-term effects of the viruses? As you mentioned earlier, some people can experience the effects for quite some time after. Are there any medicines that you should stay away from, for example?
Definitely dengue for sure. When you're not very clear as to initially the fever starts off, and as a layman person, you might not know what's the difference between Zika, chikungunya, or dengue. So what we advise is that do not immediately start yourselves on what we call as non-steroid anti-inflammatory medicines like ibuprofen or others, or even diclofenac. So usually we would advise people to take, if at all, for fever, paracetamol, not take the NSAIDs, because they may actually cause more complications in the long run, or even acutely. But definitely, you can take any amount of paracetamol up to a recommended level to calm the fever. And if you have pains, perhaps you should see a medical doctor for long-term treatment. Again, the treatment would depend upon person to person to see what symptoms are happening and how can they be alleviated.
Well, thank you so much, Dr. Prabhjot Singh, Advisor, Health Surveillance and Disease Prevention and Control at the Pan American Health Organization. Thank you so much for your time.
Thank you. Thank you for having me.